Happy Friday, Governor.
Happy Friday to you.
And to everyone at home, we begin with this question. What are the penalties for failure to comply with a quarantine order?
The initial penalty is a fine. Continued violations are punishable by a prison sentence. And obviously there'll be adjudication and due process. So again, this is the law. This is not a suggestion. It's going to save lives, and that's why we're doing it.
The next question is about RIPTA riders. They currently have a policy of 25 people per bus. This obviously violates your social distancing best practice order. Why the exemption?
I don't believe that it does violate that. You can have that many. Most of these buses have capacity for 3 or 4 times that number. So we are monitoring, and if you're close together on the bus, that's not okay, but if you can keep 6 feet apart and be on the bus. Public buses are an essential service. It's the only way some people can get to a doctor, to a hospital, to the grocery store, etc. So nothing's perfect. Nothing is perfect. We want you to stay home if you can, and all the other regulations, but some people have to get around. They don't have a car, so we have to keep the buses running.
In regard to your New York restrictions, will the guidance involve rental car companies as well?
We have not yet contacted rental car companies. We have been in touch with all of the rental property owners, and we will be getting in touch with rental car companies, primarily to ask them to provide information to any New Yorker about the quarantine. So what we're going to be asking them is to, when somebody gets their car, or somebody gets the keys for their rental, they're going to be also given a copy of the quarantine order.
So a very similar question. What happens to those directed to quarantine who do not do so? Can there be an arrest, or are you still staying with a fine?
Both. Both are options, starting with the fine.
Okay, next question. Why have you not ordered the layoff or furlough of non-essential employees, such as cafeteria workers at state colleges, for their safety and to save the state money? Any furloughs imminent?
I'm going to let my Director of Administration, Brett Smiley, handle that.
So we want to start by thanking the hardworking state workers in Rhode Island. This has been an extraordinary time for the almost 14,000 employees in state government. We are providing essential services, whether at the Department of Human Services, coverage at our prisons, our congregate care settings, and the state workers who are coming to work every day are doing a great job. Furloughs are the last thing that we want to do, and we've been taking aggressive steps to aggressively manage the budget, such as a spending freeze and a hiring freeze on non-essential state workers. And we have been taking every one of the Department of Health's suggestions and recommendations and orders to make changes in how we function. So, for example, at our cafeterias and some of our larger buildings, we still have proper social distancing measures in place. However, the seating areas have all been closed, and it's essentially grab and go. So we continue to implement new personnel policies on a daily basis in state government, but I do want to take a moment to say thank you to all the employees in state government who are still coming to work, that are making some of the same struggles and compromises and sacrifices that the rest of Rhode Island is in terms of figuring out childcare, working with the distance learning, and still providing some of the most essential services possible to Rhode Islanders at this time.
The next question says, history has revealed the many barriers that have been put in place throughout time to block women from reaching leadership positions, particularly in government and science. Can you share any feedback that you've received from younger women following in your footsteps?
I love that question. By the way, I surround myself with talented women and want to again thank Dr. Nicole Alexander Scott, Courtney Hawkins, Angelica Infante Green. Women are very much on the front line for the people of Rhode Island fighting this crisis. One of the cutest stories that I have heard is apparently there are little girls all over Rhode Island in their living room setting up podiums to do the daily briefing. I love that. I hope every girl knows that they can be the leader. But you know, on a more serious note, I think that being a leader is a burden, and it's an honor. And to all the younger women out there, I hope you will know that you can and should be leaders yourselves, because if you get in the game, better decisions will be made.
Governor, we're hearing a lot of frustration with the unemployment system, for example, error message, long call times. What do you say to those people having a difficult time navigating the system?
Yeah. I say I'm sorry that that is the case. The volume that we are receiving is truly unprecedented. To give you a feel for it, the number of daily claims that we are receiving, or the number of daily applications and filings, exceeds the weekly filings that we were receiving in the last recession. So our system isn't built to handle this, and it's going to take us a little bit of time to get our feet under us. So I'm going to ask for a little bit of patience. Here's what we are doing. We are furiously looking to take steps out of the process. So some of it is that our technology is old. Some of it is that the volume is like 10 times what we've ever had before. But some of it is we need to simplify the process. So I'm very hopeful that, again, next week will be better than this week, the week after that, even better. We're staffing it up, improving technology where we can. We have some technology fixes on the way, but really we're changing the process to take steps out of it, making it easier, waiving regulations in ways that we can in order to get you your checks as fast as possible. So I realize that's not a satisfying answer. We're doing the best we can. The money will come to you, and we'll get it out as fast as we can. And if you're under extreme circumstances, as I know some of you are, let us know. You know, call DLT, call 521-HELP, reach out to my office. We'll do everything we possibly can to get you money as fast as we can.
Governor, with several...
one last thing on that. Some of the problem also is the federal government's website. We were on a call yesterday with the president, vice president, and others. The federal website, which we have to interface with, is also not equipped for this volume. So at the same time we're fixing what we need to fix, the feds need to do that, and as I understand it, they're doing that as well. So long-winded way of saying help's on the way, and we're going to get even better.
The next question is, with several nursing homes in Massachusetts having had coronavirus cases, have there been any cases of presumed positives in nursing homes, either among patient or staff in Rhode Island? Are all staff being screened prior to coming to work here?
This is an important question because this is the setting that we are being very aggressive in assessing and testing. So we have had some cases that have been associated more so with staff than patients, oftentimes from community acquiring. But then we are extremely aggressive in how we are responding, both in terms of swabbing as well as in terms of the infection control policies, and for sure assessing the screening policies that are extremely critical to enforce, both for visitors, which are none in nursing home settings, but in any other congregate setting, we're working on making sure that that's the case as well, but as well as with staff, making sure that staff are being screened. So we thank nursing homes, as the governor mentioned earlier today. It's a very critical population, and we are working very closely to address any concerns with cases.
Governor, back to the quarantine issue. The enforcement of the quarantine orders are going to be top of mind. Are you concerned with the optics of military officials going door to door and the impact that might have on the public's psychology?
Of course I'm concerned with that. This is not a decision that I wanted to make or one that I took lightly. Having said that, there's no other choice. I have to make decisions that I believe in their best interest of keeping Rhode Islanders alive. So yes, I don't like those optics, but I'll tell you the optics that I like even less, the optics of Rhode Island Hospital bursting at the seams, not being able to take care of all the patients that we have, the optics that I'm seeing in Seattle, Washington, in New York City, in New Orleans, in Milan, and around the globe. That's what I don't want to come our way. We know New York's a hot spot. We know it's a dangerous place. We know it's 180 miles away. So I'm having to make very difficult decisions, and it is what it is. It is what it is. We are trying to take the lightest touch we can, but the most effective touch. And I actually have great confidence in the Rhode Island State Police and in our National Guard that they will be absolutely professional in the way that they execute my order. Having said that, these quarantines are orders, and if you're coming here from New York, you will be required to obey the quarantine order for 14 days.
The next two questions are continuing this thought. The ACLU has issued a statement on the order regarding restrictions on New York travelers, and they say it is unconstitutional. How do you respond to this?
I am not surprised that the ACLU would have that view. I respect that opinion, and under a normal set of circumstances, I would not be choosing to make this decision. Having said that, this is a state of emergency. It is a public health crisis, and it's imperative that we collect information so we can do contact tracing, and that we ask folks to be in quarantine for 14 days. It's consistent with all the guidance we're getting from the federal government and from experts, and it's what I know to be necessary in order to keep Rhode Islanders safe.
The next question is for Dr. Alexander Scott. You said in your comments that we need people to be vigilant. Are you encouraging people to call their local police if a summer resident from New York moves into the neighborhood?
In saying we need people to be vigilant, that involves being thoughtful about how we are approaching this. We do not want to promote, across the board discrimination in any way. We are following what the governor has said in terms of becoming pinpointed in how we are approaching this. We want to make sure that we are capturing people who have returned to the state from places where there are many cases and helping to make sure that they are quarantined. That is an appropriate response that we should be doing from across the board. It is in alignment with the fact that if anyone has traveled back to Rhode Island with domestic travel anywhere, we are asking them to be quarantined as well. So that is the vigilance, helping each other implement this quarantine effectively and supporting each other in doing it appropriately.
Governor, the next question is very similar.
I'd like to, I agree with Dr. Nicole Alexander Scott. I would answer it slightly differently. If that is your next door neighbor, you should go and say, as you know, you've been ordered into quarantine. Can I give you a hand to go get you your groceries or whatever you might need in order to obey with that quarantine? And because anything you can do, there's a heavy-handed approach, but really, we're doing this to keep these people healthy as well. So anything that we all can do to enable the quarantine, delivering groceries, giving them a call, make sure they don't feel isolated, helping them out, that's really the best way to effectuate the quarantine.
The question asked, Governor Allman's former legal counsel says your order regarding New York is not in line with federal guidance or constitutional because you are targeting all of New York State using license plates rather than the New York metro area. How do you respond to this question?
The CDC and the Trump administration have given guidance as it relates to the entire state of New York. So I followed that guidance. Secondly, there are practical realities as it relates to how to enforce this. I have lawyers on my side advising me as well. This is an emergency, and what is constitutional in one scenario is different than in another. This is pinpointed, this is targeted, this is a state of emergency, this is limited in time, this will be enforced in a respectful way, and it's a public health necessity.
Has the Coast Guard been enlisted to help with monitoring the coastal communities by boat?
Not yet, although that's an interesting idea and something I might look into.
If the plan with 1,000 tests a day to begin testing everyone in the state, whether symptomatic or not, what are the statistics of those groups coming off quarantine of how many were infected and tested?
We want this focus on ramping up testing to continue to target patients who have symptoms. That's for sure the way that the test works most effectively. If you have symptoms and we test, the reliability and accuracy of that test is most helpful.
Since some COVID-19 patients have recovered, can we have a count of them and perhaps change the numbers reported each day as both total cases identified in the state and the number of patients fighting the disease today?
Absolutely. As the numbers are increasing, we are looking to reshape how we are reporting them. So we are taking into account suggestions such as these, and we'll be working towards having a systematic way to continue to update. So thank you for that.
We have a number of healthcare workers saying dozens of New Yorkers have been admitted to local hospitals to deliver their children here. Can you tell us if this is an issue?
This is similar to how we have to be thoughtful about our approach to people from surrounding states. We recognize the importance of making sure that people who arrive here are quarantined. I absolutely support what the governor said, in that we are supporting them as well. We're doing this to keep them safe as well. And we need to take into account those who also are in their third trimester and are looking to deliver babies, which is an important thing to do. So we want to make sure that we support what that work is, but then also do it in a way that we are addressing the changes from the states that are around us in an effective way, as well as continuing to make sure that people receive the services that they need.
Again, another glimpse into the hospital. How many are intubated in Rhode Island?
There are 7 who are intubated among the 11 who are in the ICU currently. That number continues to evolve.
And our last question today for this briefing, based on current projections, do you still expect the number of COVID infections to continue rising?
Yes, we do. That's an important point to make. As we work towards expanding testing the way we plan to do, just by that adjustment and advancement alone, we will be seeing more cases. We will be identifying more of the people who are out there with symptoms as having COVID-19. Until that time, it's important to continue to reiterate, if you have symptoms of any viral respiratory illness, we want you to stay at home, recover safely there. Whether it's the flu or a cold or COVID-19, the treatment is the same, and being able to recover safely at home is critical to stopping the spread of this illness and other viruses during this time.